Hi there. Welcome to Ask the Vet with Dr. Tom Tully. Hey, Dr. Tully, thanks for joining us. So I thought I'm going to try this. Let's hope this works. I'm going to do a pop quiz. So I have just 2 questions today since this is our first quiz. That way, next time you guys have more time to study ahead of time to try to guess what questions I'm going to ask you. So I got 2 short questions for you today. We'll do this while we wait for people to log in and join us. So here we go. I'm going to launch the poll. And how many veterinary colleges are there in the United States? That's our question number 1. And question number 2 is, when was the first veterinary college established in the United States? So let's see if anyone is, this is interesting. Wow, people are doing way better than I thought. On the first one, let's see. So I had to look this up because I did not know this on the top of my head. So I was curious.
Yeah, and one of the things, Laura, there's been probably within the last 5 to 10 years, there's been probably 3 or 4 new veterinary schools, colleges that have started, and a couple of more that are looking to start. I think they're not currently. I think Arizona in Tucson, and also Texas Tech and Lubbock are 2 that are possibly going to be coming online.
Interesting. I was trying to find an even more specific thing, and that was on the amount of veterinary colleges that offer avian medicine. But I'm still searching for that answer. So maybe next time I'll have that for us.
We all would like to know that. Let's put it this way: more than there were 30 years ago, and more than there were 20 years ago. And so I think it's, again, within the whole realm of zoological medicine, which includes reptile and also the small mammal. And they call herptile, which is kind of reptile and amphibian, but also the exotic small mammals, which you say exotic. Well, what's that? A rabbit? Is that exotic? But it's not a dog and a cat. So rabbits, guinea pigs, ferrets. So it's all kind of put together in zoological medicine. And avian is in that.
I just find it fascinating that veterinarians could have the aptitude to know the anatomical layout of different animals, because they're so different, like amphibians versus birds versus man. I mean, it's a very big variety to.
Well, I am a firm believer you can't be a specialist in like avian medicine, and you can't be a specialist in like, well, I'm a specialist in avian, I'm a specialist in small exotic mammal, I'm a specialist in herptile and reptile, because it's so involved, so much information, and the techniques that you have to use. Now you can treat those, but when you're looking for a specialist to know all of the aspects and who to contact if you don't know, it's just, to me, impossible. No different than it would be, oh, well, I'm going to my cardiologist, but he also works on humans, and so I'm going to see him with my eye problem. Well, I'm a specialist in cardiology and gastroenterology and ophthalmology. It's not, and surgery is very specific too. You have your orthopedic surgeons, and so you're correct. You can treat those animals, but also the one thing that you're looking at is that they're diverse, but it's medicine in general. When you're looking at it as a whole, all of those animals have blood, all of those animals have a heart, all those animals have the anatomy, You know, it's a little bit different. Snakes don't have legs, right? Or wings. But still, you look at it from a medicine standpoint. And if you utilize your basic foundation of medicine, then that gives you a good, solid foundation to move forward.
That's fascinating. That's a good, that's some good insight there. I was always just, there's just so many different body types in the animal kingdom. So, so let's see. So for our pop quiz today, question number 1 was, how many veterinary colleges are there in the United States? The choices were 10, 30, 75, and then the last choice was 100. What's your guess, Dr. Tully? I will tell you the answer in a second.
Well, I would say 30.
You are correct. So congrats to all those who selected 30. There are, according to my Googling, there are 30 colleges in the United States that offer degrees in veterinary medicine, or veterinary colleges in the United States. And then question number 2 was, when was the first veterinary college established in the United States? And the choices were 1802, 1852, and 1902. And any guesses on that?
For me?
Yeah.
I would I would have to say 1902.
Close, but it's actually 1852.
Wow. Well, there you
go. So
No.
25. So the percentage of answers, we had 13% for 1802, 25% for 1852, and 63% for 1902. So accordingly, it looks the Veterinary College of Philadelphia was established in 1852. And it was in operation until 1866. And then in 1883, the School of Veterinary Medicine at the University of Pennsylvania was established and is the oldest accredited veterinary school still in operation. So some trivia for y'all.
Yeah, well, that was correct, obviously, but I went with the majority on that at 1902.
There you go. I'm sure there's been many many advances in medicine since then.
We hope so, at least. Bloodletting, you know.
Can you imagine that? Wow, yeah, like leeches and stuff. That's what we're doing on people back then. So, anyways, exactly. All right. So I think we'll go ahead and we will dive into this webinar. Once again, we are very excited to be back with you, with Dr. Tully, on answering your vet questions. So it's Q&A with Dr. Tully. And do you want to start with any words of wisdom? Or
yeah, I think that one of the things that I'm going to start with is that I have a number of bird owners come in and want to know about a couple of things. One, how old their bird is, and 2, then the next question would be, or it's usually a statement that, gosh, this bird's going to live forever, and I'm going to have to put it in the will. I'm going to have to find somebody to take the bird or whatever. Excuse me. And the bird is maybe relatively old, but I guess it's one of these things where you look at how old and how long do parrots live. Parrots as a group. And I think that based on my experience, also some of the literature that's out there, that I don't think that the birds, even under the best of care and under the best of health, live quite as long as people think. The smaller the bird, usually you're looking at a patient, you're looking at an animal that is going to live a shorter period of time than the larger birds, which is somewhat inverse to dogs, where the larger breed dogs tend to have a shorter lifespan and the smaller breed dogs have a longer lifespan. It's a little bit different in birds, where the smaller the bird, it's a shorter lifespan, and the larger the bird, the longer the lifespan. So if we're looking at something like a budgie, you're looking at say 8 to 12 years. Now, everybody goes, well, some people, I know one that lived to 18 years. I know one that maybe lived to 20. And we did have a budgie patient. He would sleep with his head under a bell every night, 18 years old. Cockatiels, average for a normal cockatiel, not a mutation, color mutation, is 15 years. Now, so, well, I know one that lived 28. Yeah, well, it's similar to people. How long? What's the average lifespan of a human in the U.S.? If you look at women, live longer than men on average, and what's that? Probably 80. Let's just say 80, give or take a few years. Men, it's like 78 or something like that. I wish it was longer, but that's it. That's the average. Some people die sooner. You say, I know people that have died, before they've reached 80. And then that there are people, and people, my grandmother lived to 98, okay? So when we're saying average, that's the average. It's not like what can happen depending on genetics and care and diet and everything else that has a big factor in how long the bird can live. You're looking at conures. Conures can live 20, 25 years. Your small parrots on average. And then when you get to your larger parrots, such as your Amazons, your African grays, you're looking at 30 to 40 years, okay? Your macaws, especially the macaws, and a lot of the information, because they have had so many macaws and have worked so much with macaws down at Parrot Jungle, I think that they have looking at average as far as maybe 45 to 50 years for macaws. So that's a fairly long period of time. But when you're looking at some of the parrots, when people say, oh, they'll live to 80, 90, 100, there, Brenda knows of one that had lived that long, and possibly others that have a history, a known history of living that long. And maybe on the internet you can find where there's a known history of that, but that's unusual. Just like the lady in France that lived to 120 years old. Okay, how many people live to 120? But it's possible. Okay, so what we're looking at medically is that when you have a number of parrots that are that we take care of that are in the 30 to 40 year range, but very few that are over 40. Extremely very few that are over 40. And many times we'll have a 40-year-old parrot that's been in the family for 40 years, usually comes in, it hasn't been seen for much of its life by any medical professional. And when it comes in, the bird is usually critical. It's in a critical condition, because you go, well, what happens? Birds get old age diseases, the same that humans get. They have cardiovascular disease. They get cancer. Their body just wears out just like any other animal, and including humans. Older birds, we're not. It's very difficult to delineate where you're having a, say, well, what's the age of my bird? Well, you can tell a young bird. Many times you can tell a young bird because of the eye coloration and different aspects of that. And maybe feather color. But as far as a bird that is, say, has reached a maturity till the time that it's old, it's very difficult to tell what the age of that bird is, other than it's an adult. Now, for an older bird, the different signs that you look for an older bird would be, say, the skin. The skin sometimes becomes thickened on older birds, whereas in humans you see more of a thinning of the skin. And then you see feather coloration just isn't as bright. There may be more wrinkling in older birds, and then older birds also get cataracts or lens opacity, just like humans do. So if you see a bird that has an unknown history, but has some of these characteristics, and especially lens opacity, then that would be more of a geriatric bird, an older bird. So just wanted to kind of give an idea on how that plays out as far as age of the bird, because there are factors that cause birds to have that average lifespan. And I think a lot of people aren't aware that many of the diseases that humans get when they get older, birds get also.
Interesting. I know that doesn't birds that have the leg bands, would the leg band have the hatch date? Don't they typically? Would that be a clue? Like, say you adopted a bird, what the age might be based on the leg band information?
The leg band information is somewhat dependent upon what the person who placed that leg band on wants it to say. Okay. If you're looking at maybe some of the leg bands that with some of the birds that may have been imported prior to 1993, that may have a date just of importation, and then that may have some of the information on that leg band that is related to the importation, not necessarily when that bird was born, but when it was imported, possibly. Now, when you're getting into breeders and people who are raising these birds and have their own leg bands that may or may not be associated with a bird association, that they may have the hatch date on that band. The problem is that you really can't tell when that band was put on or what the numbering meant. Very possibly it could, Laura, but I don't think that there's any
there's no standard, right?
Yeah, that's what it is. But good question, and on that.
So we're waiting. Sorry, as we're waiting for our questions to come in to answer. Just going back real quick to the old age diseases that birds can get. Arthritis, right? They can get arthritic feet and stuff.
Yes.
As far as that goes, for perching, it seems like that would that change maybe the type of perches you would offer for a geriatric bird? They have like arthritic feet, legs, joints.
Yeah. The perches, again, you would want to make sure that the bird would have kind of a variety of diameters to try to and with that perch to make sure that it would have an ability to actually find the most comfortable area that it could be perching, or position that it would be perching, as opposed to, well, it's all uniform, and so hopefully it doesn't hurt, but if it does, too bad. Also that we have found, and this is advances that we've made in medicine, is having different what I would consider medications for pain relief. No different than humans that have arthritic conditions or are painful in the joints, may take Advil or something of that nature. We have something similar that has been found to be helpful in birds, especially older birds, and that can be given on a regular basis to try to reduce the birds having pain in those joints. But that's something that is that we see from time to time, and we've actually seen that in some of our resident raptors. We have a wildlife hospital here at LSU, and we have resident raptors we use for teaching, red-tailed hawks, barred owls, and some of those live quite long. We had Morgan, red-tailed hawk, that lived over 30 years here at the veterinary school. Outlived, I think, 2 or 3 replacements that, oh, well, she's not gonna, we gotta have a replacement. But she did well, but over time they do get these conditions that we can provide pain relief and perching, and for them to find the most comfortable position.
All right. Well, we've got a question here for you from Cece. And Cece asks, I would like to know what next test should be for my bird who has black, and then in parentheses, bronzed feathers, which improved with adding daily vitamins, but got worse again. She has always had a dry sneeze, treated with antibiotics, but that did nothing. She eats great, beans and veggies, mashed mostly, and 1 tablespoon or 1 teaspoon, I think, of nut seed daily, and offered pellets. She has E. coli and was treated and given the all clear, but still also has loose stools. The kidney came out fine. That's the question.
Well, when you're talking about discoloration of feathers, and I'm not sure exactly what type of bird it is, but what comes to mind is like an Amazon, green feathers that kind of turn, black, and that's one of the questions of, why is this discoloration? One thing that you look at with the feathers, and looking at the beautiful feathers behind you as your backdrop there, is the fact that you get the color in the feathers sometimes due to the pigment within the feathers as they grow out. And this is somewhat similar in canaries, where you have red factor canaries, where they give them a red coloration when the feathers, the canaries are molting, and the red coloration in the feathers will actually grow into the feathers and be deposited into those feathers as those feathers are growing. That's also something similar in flamingos and roseate spoonbills, where they have to, in zoos, they give them a coloration so they can have within their food and diet, so that they will have pink feathers. In nature, they get that from crustaceans that they eat normally. So the feathers can get coloration as they're growing. Now, once they have grown out, the only way to color the feathers is with a Sharpie or something. You're not going to be able to do anything physiologically to get those feathers to change colors. So you're set with those colors after they've grown out until they molt them again. And that's the, and then the other way that there can be feather coloration is a spectrum, where you have the light is affected as it bounces off of the feathers, and the feather structure causes that coloration to occur. So depending on the bird, and the different color and the abnormal coloration of feathers, the bronzing or the black feathers, it's either structural, where the feathers have issues with structure, or as they grow out on that. So again, with what the bird intakes as far as dietary nutrition, when they are growing those feathers out, that's going to have a lot to do with the quality of feathers that you get, and ultimately shown as a very pretty bird with normal feathers, or with abnormal feathers that need to be that are problematic. So nutrition is the key, and that is why to try to provide, as we've talked about, the diverse diet, and that's why part of that diet would include something where you would, I guess, a dietary element that would provide the vitamins and nutrients that that bird would need, and so and so I would say that that's where you have a nutritional supplement, and there's vitamins that you can provide for feathering. Also, that's where the pelleted diets come into play, because they have vitamins and nutrients. Now, and so you want to make sure that, especially during molting, because that's a lot of stress on the bird, and then the bird is needing all of those elements to make sure that they have good feathers. So that's kind of the basis for having that. Now, one of the things that you can have abnormal is that they have correlated this to possible liver disease. Now, I know that you had mentioned kidney disease. The kidney testing was normal, but with liver disease, it's been speculated that that could cause issues with feather coloration in these has all of the liver disease would cause this abnormal coloration. So a test that you would look at is the possibility of, say, liver function. To look at liver function would be a test.
Okay. Okay. And then I have a question from Raina. Asks, my 3-year-old Fisher's lovebird chooses to fly to family members other than me to bite. How to stop this behavior? He's fine with me. And yeah, any behavioral issues that any behavioral tips that you could offer for that?
Now this Fisher's lovebird does what now?
I think we're fine. Yeah. That was a behavior question about a Fisher's lovebird that likes to fly to other family members other than Raina to bite. So the lovebird flies to other family members to bite. It looks like it. Yeah.
Yeah. I don't know if it bites Raina.
I'm not sure. Yeah, it sounds like it's flying. The bird's flying other family members and to other than them to bite. So
well, the one thing about a lovebird is that it's a misnomer. Lovebirds are very nice, and actually my first bird was a lovebird, but they can be little devils, okay, and they can bite, and it hurts. I can tell you, but the behavior issue with lovebirds is that you have to interact quite a bit with them. I think that it's going to be very difficult to do any type of quick behavior modification for the lovebird. And in this case, if it's flying, then you may want to restrict some of the flight capabilities of the little lovebird, because that's one thing that you can do, so it doesn't actually have the ability to fly so very well to other people. And then the other issue is just to not make, just to keep it in its cage if other family members are around at that time. But as far as trying to get those family members who may not want to be so involved in getting the little lovebird to like them, they may not say, I'm not going to take time to try to work with this. I don't, I know you love your little lovebird, but just make sure it doesn't fly on me and bite me.
And get swatted away. And
exactly. So you may have some type of reluctant interaction. So those are the two things that I can say that, because lovebirds, it would take some time and effort by others that may not really want to put in that time and effort to prevent that.
Okay, thank you for tackling that question. We have one from Claire, and she says, I have an African gray that will initiate bath time a couple times a month, but otherwise does not like water. Is this enough bathing time for him to maintain his feather health?
Yes. And if he didn't want to bathe at all, then that's fine. I have not found any issues with birds that are adverse to water. And so they're very, I would say, fastidious in their grooming. And there's no reason to scare the bird. There's no reason, I had my Derby, and I could get the spray bottle and it would just, anytime I could spray the whole bottle on the bird, and it loved it. Or people take the birds in the shower, or the birds get into, they put the water, kind of a bathing bowl in there, and the birds do well. And then other birds, it's just like, get it away. I don't want it. And it does not have anything to do with their, in my experience, no adverse, problems feather-wise or anything else if they're never bathed.
Okay, and it might just be a bird's preference that they haven't tried yet. Maybe the owner hasn't tried offering it with a spray bottle, or in getting the mist from a shower, or in a
right.
Maybe just try different variations of water, right?
Correct. Whatever, you can try those variations. That's a great suggestion. But just be aware if the bird is like, and especially grays, right? They don't like anything new. They're afraid of their own shadow if they see it for the first time. And so you just don't want to say, oh, you'll like it. Here, look, you'll like it, and the bird's going, you don't want that. No.
All right. Thanks. So we have another question. Eileen asks, is there anything that you can do for a bird suffering from vitamin A deficiency? Is there a supplement or just fresh fruit and veggies? Also, is there a natural anti-inflammatory for a bird that was injured?
As far as vitamin A supplementation, that is where you can get, if you want to make sure, that's where having a pelleted diet of some sort or a formulated diet that has the vitamins impregnated in those diets. And so you have a much better chance of, say, providing the needed vitamins and minerals that would be required for the bird over and above what they would eat, say, within a seed diet or what have you. and like I said, that's why the diversity on the diet gives you a better chance of providing the nutrients that that bird needs. Also, if you want to provide vitamins within the food or water, Nekton vitamins are ones that I've always felt that are very good vitamins, Nekton, and they have vitamins for feathers. They have and they have generalized vitamins. The one thing about vitamins in the water, they degrade quickly if you put them in the water, and so you'll have to change that. So it's a little bit more on your part. And then, of course, that to me is more helpful. Now, if you give them fruits or, well, mainly vegetables, fruits are a lot sugar and water. But if you give them vegetables or anything fresh, that also requires you to change that out more often. So if you don't have time, it may be better for a vitamin or a pelleted diet or a diverse diet to get your vitamin A in there. And then there was a question about a natural anti-inflammatory. You know, I know that there are some that there's nothing that I can recommend that is scientifically validated. We're looking at some of the anti-inflammatories that people are recommending that are more on the natural side, something like CBD oil, or you know, some of your marijuana derivatives that are out there that they're promoting for humans. One thing that we're trying to do is to see if birds can actually get therapeutic levels of this. So there are, and this is some of the advancements that we're trying to make medically, that some of the products that may be out there for anti-inflammatory that you can use over a period of time that would be relatively safe. This is all still under investigation, although some people are using it. It's just how effective it is. And for years, we used phenobarbital in African greys for seizure activity, and then it was given orally, and then we come to find out that, well, they don't even absorb it. They're not even getting any in their bloodstream. So, you know, that's one of the things that we have to validate the ability to use it. But there are things that we're looking at as far as the natural products are concerned, and that is one of them.
Oh, wow. Okay. That'd be interesting to learn more about that later. So we have a question from Daniela. She asks, does captivity shorten the expected lifespan of a parrot even with the best of care since birth?
I would say that it lengthens it significantly.
Okay.
Probably doubles it under care. The world is a cruel place.
Yeah.
And if it is, you're saying under the best of care, then that bird is protected. That bird is getting all of the nutrients it needs. It doesn't have to look for, food, and it doesn't have to be concerned about the predator it doesn't see. And so, and if the bird becomes a little bit slower, the first time it's a little bit slower in getting away is the last time it's slow getting away. And so in captivity, I would say, and this is just in general with all of the animals that are cared for that are wild animals. And that would go for your dogs and cats if they were out there living in the wild. You know, you're not going to have a 20-year-old cat in the wild, you know.
And wild parrots, they're susceptible to some diseases that you might be able to catch and treat on a captive parrot.
Oh, well,
Like,
yeah, well, for sure. You know, that, I mean, that's involved in that too. And then if the animal has a disease or fractures a leg or a wing, I mean, we get these wild animals all the time that come in that people find. I mean, like eagles, hawks, owls that are injured. And if the people don't find them, they're going to die. But of course, in captivity, they're going to live. That's a good question, but there's no doubt that they're going to live a lot longer.
Okay, thanks. Barbara asks, how active should an 8-week-old Quaker be? Mine is happy just perching in its cage and prefers sitting on my chest or shoulder to sleep. Is this okay? Should he be more active as a baby?
Not necessarily. Each one is a little bit different. If it's and usually with a young bird like that, what you're looking at is normal feeding activity. You're looking at maintaining its weight, or elevating its weight as it grows, and keeping that, feeling the keel area to make sure that muscling of the keel is robust in that it has good body condition, and that the stool is normal. And so if the bird is doing that, then it's growing, it's having normal eating habits, and doing well. And so and most of the energy is spent, trying to make sure, get the feathering and everything else in. So I wouldn't say that would be outside of the realm of normal, a normal condition. Now, if the bird is not eating as much as it would, it's not passing the food, it's losing weight, anything like that, and it's not responsive, and then that's something that would be of good concern.
Okay. And then I have a question from Chris, who asks, my gray is now blind and no vet knows why, not even an avian vet. I have had her 33 years and got her in Africa, so she may have been wild caught. No idea for the age. Her health is otherwise good. Any suggestions? She seems happy, chatty, and affectionate. She's much loved, so wish her life to be the happiest possible.
Well, the when you're talking about blind, the one thing that you would look at, if somebody was considering, they said my bird is blind, then what you would have to do is, it's not the avian vet that's going to be the person that would help you determine what the condition is that's causing that blindness. The avian vet would refer it to an ophthalmologist, and the ophthalmologist, the veterinary ophthalmologist, who would be comfortable in looking at birds. Ours here, of course, see many bird eyes, and they would make a determination on what is causing the blindness, what's associated with the blindness. We had a little linealated parakeet that was, the owner said, the bird can't see. And it was squinting, and it was abnormal position, and apparently it couldn't see. So that would be a definition of blindness, right? Can't see. And so ultimately we were able to make a diagnosis. It was cancer. Okay. It was a lymphoma. It was a generalized cancer, a blood cancer, on that we were able to determine through blood testing, I should say, and caused severe inflammation in the eye. And the bird couldn't see because the eye was so inflamed inside. So there's also a 33-year-old African gray is an old African gray, right? And so when you're looking at that, there could be lens opacities that are blocking that. Now, I would say that the average veterinarian should be able to see that, and it may not be lens opacities, but that's another reason. But the bottom line is to find an ophthalmologist that would be able to tell you what is going on and what is causing that blindness.
Would that so someone looking for a very specialized field of avian ophthalmology would maybe start with like a veterinary college that offers avian medicine? I'm just trying to, like, it seems like a hard
no.
Is it?
You're just looking for a veterinary ophthalmologist that would be able to and willing to do the exam on the bird. Our ophthalmologists here are not avian ophthalmologists, they're veterinary ophthalmologists and use their expertise in ophthalmology to examine the bird eye.
Okay. That's
Yeah.
interesting, because bird eye is so fascinating.
So just need to find an ophthalmologist to look at that, and then they could go and give you a diagnosis of what they find, and then if it's not in the eye, then it may be in the brain. Okay, that's when you look at maybe an MRI or something like that would maybe pick up some type of a tumor or something of that nature, that although the bird is normal otherwise, it is affecting the ability of that bird to see. But first of all, you need to know what the health of the eyes are and what the condition of the eyes are to say, is it in the eye or in the eyes itself, or is it within the body, like the linealated parakeet? Yeah.
All right. That's interesting. So Elizabeth asks, how do we know if a bird is in pain, such as arthritis, and needs medication?
That's a very good question, and something that we try to stress very highly to our students that are going through, and also I bring up in continuing education classes. Pain in birds is very similar to pain in humans. Okay. One thing that you look at, as far as you talk about arthritis in general, if the bird is not using its feet and to get around, or perching, and when they're perching, they may be shifting from one leg to another. And so when you have disuse of a limb, a wing's drooping, they're not using a leg, that is usually denotes pain or some type of a neurologic condition. And so that's one way. Vocalization. vocalization. If the bird, especially if you touch something. One time my mother pulled the kind of, she thought it was a feather out of her African gray, and she thought it was just molting, and so it just hadn't come out of the feathers on the wing. Now she says the bird said, "Stop, that hurts." Now I'm not going to say that the bird's going to tell you that it hurts, but usually they're not going to vocalize, "Stop, that hurts." That's a whole nother story for another time. But they'll ah, you know, or squawk or something of this nature. They'll vocalize if you know, touch it or something like that. Also, not eating is usually a sign of pain. When they're not acting normal, meaning they're more what we'll call depressed, kind of down, they're not, that is also a sign of pain. Squinting is a sign of pain also. Now you're thinking of all of these things and you're going like, well, that sounds like what people do. Yes, so a lot of the pain signs that you would associate with somebody, that you see somebody walking and limping, they must be in pain, you know, where they're not, you know, it's not you, or they're not telling you they're in pain, but you can see that, or that they do something and they wince or something like that. It's very similar in birds. And the last thing that, as far as pain, if something happens to a bird or you see it and you say, I don't know if it's in pain or not. If it happened to you, would you be in pain, or would you feel you would be in pain? So you anthropomorphize and you go, well, if it was me, that would hurt. So that's kind of the last kind of criteria on pain. But as you see, a lot of the signs of pain that people have, birds have.
Okay, that's good to know. I years ago, I had my conure and my cockatiel had an interaction where I heard a squawk, and it was from the cockatiel. And then I noticed he was flicking his beak around, and then on closer examination, he had a dent in it from the pinch of the conure. And so that's when I knew he was in pain. I immediately noticed that that interaction was a little bit more involved than I initially thought, just by his behavior with his head flicking back and forth, trying to like shake something off his beak almost.
Yeah. And that's, and then you'll notice sometimes birds, like, if something happens, they'll be and this is also what we'll see if there's some type of a mass or a tumor or ingrown feather, where the birds will keep picking at it. They'll keep picking at it, and they'll cause it to bleed or whatever. Well, they're doing that because it's bothering them. It's painful, and so that's what another thing that you can see.
Okay, so I have a follow-up question about the blind gray that you answered earlier. The owner says that her eyes are dilated and reddish, no cataracts, and it happened over a 2-year period. So any more insight on those clues?
No, they said that the eyes are dilated.
They're dilated and reddish.
Yeah.
This is on an African gray. That's blowing.
And that's again where you get the ophthalmologist to look at that, and you can see the ophthalmologist, depending on what the retina looks like, what the posterior chamber that's this side of on the other side of the lens, you have the cornea, and then you have the in front of the lens, you have anterior chamber, and posterior chambers on the other side of the lens, and then the retina. And so the ophthalmologist would look at all of that, and they also have, but depending on what they see, they can determine what would cause the condition, what are the possible causes of the conditions that they see. If they can't tell anything, and that's the first, and to me, that's the first thing you have to do, is get an ophthalmologist to look at it. But if they can't tell anything, then you're looking at the possibility of a more generalized condition. We've had birds with grays, in fact, that have had strokes. You can look at specific tumors that may affect it. But before I would go there, I would say, having an ophthalmologist give their thoughts on this would be the most helpful on leading you to a direction to what may be causing it.
Okay, and then I have a question from Nancy. We have recently adopted a wonderful African gray who plucks our barber's her feathers. Her breast and belly are quite bare. We want to get her some sun in her Paco bird while the weather's nice, but wonder if we have to limit the exposure. Is skin cancer a concern for plucked birds?
Not I would say in general, no, it isn't. Again, if I would say that if the bird was not for the full day in direct sunlight, that would probably be optimum, where there was some shade involved and that it wasn't too hot. And we had talked about heat in birds, in a previous webinar. But as far as skin cancer, I would say no. Now,
Okay.
If it is too bright, and again, if you're looking at, many times the feathers, the wings are going to cover the back of the bird, so you're not going to get a lot of direct sunlight exposure on the ventrum, if you will, the chest. And so the wings are covering the back, so you're not going to get a lot of direct exposure to that. So I would say no. It wouldn't be something to be concerned about.
Okay, next question comes from Darren. My 18-year-old red-fronted macaw had 5 episodes over 3 days of what I can think can only be described as strokes or seizures. This happened a month ago. They usually lasted around 20 minutes, and with the worst one being right side paralysis and pretty much full recovery in an hour or so. Lab blood results showed no significant findings. Still worried about him and wondering if there are more tests I can or should do. Is it likely that there'll be more episodes with varying degrees of severity? And then I've seen online people describing the plethora of medical testing procedures and medications they've done for their bird. I don't know if I could put them through that, especially if there's a chance this was an isolated incident.
Well, that is, neurologic conditions are difficult, and that's to identify, and that's one reason when you have seizure activity. That's one reason you see all of these diagnostic tests, because you need to try to figure out what's causing the seizure activity. And of course, when you have in humans, you hear idiopathic epilepsy. Idiopathic epilepsy, just idiopathic. When you hear idiopathic, that means we don't know what in the world's going on. Okay, idiopathic, don't know, but you're having seizures, so here's some seizure medication, right? And so the testing is when you're looking at it, the seizure activity obviously is abnormal, and so you don't know if it's a female or a male, and that's something we can get into in another webinar. But calcium, when you have low calcium, that can cause seizure activity. And so, of course, a brain tumor can cause seizure activity. Stroke could cause seizure activity. You can have trauma that has occurred where the bird has hit its head, and when it's hit its head has caused some brain damage, and that brain damage results in the brain not working normally, and you can have seizures. Also, what could cause seizure activity is, I think I may have mentioned tumor, or I mentioned one other thing with heavy metal toxicity, lead toxicity. And you're like, well, I'm not feeding my bird lead. Well, you wouldn't be the first person. I think everybody I've mentioned lead toxicity to says, you're crazy, Doc. I don't feed my bird lead. But it ends up being lead toxicity. Not in every case, but in a number where they have clinical signs associated with lead toxicity. One is seizure activity, not all. So that's one of the tests that you look for. And so zinc can possibly cause it too, zinc toxicosis, and that's more likely to be exposed. Birds are more exposed to that. So, you know, you can hope that it doesn't happen again, but if nothing is, and you went and the blood work looks normal, you said. So that would probably get it out of the heavy metal toxicity. It's an 18-year-old red front macaw, I think it was. Yeah. So the possibilities that you're looking at there then require some other testing. Make sure that it has calcium. Make sure that it has mineral block. I don't know if it's been laying eggs. Let's say it hadn't been laying eggs, but you still need to make sure that it has the calcium in there. Also with the macaw, I don't know what the diet over time has been, but of course there could be cardiovascular disease that's associated with this, or a tumor. Just to have a seizure and that they all go away because nothing is done, that's something to hope for. But I surely would monitor the bird, because the tests are something that you could do. We've come a long way with anti-seizure medication in birds. So there's something that we can do to try to alleviate that. I'm just thinking of a little parrot that I have on anti-seizure medication right now, because when you're looking at all the tests, how much can you do on a 28-gram parrot? So at this point, I've talked to the owner, and it wasn't quite, he was having regular seizures. And so I saw the bird 3 weeks ago, and we've had it and we've regulated. And of course, when you're on seizure medication, you have to try to really regulate that medication so it works, and you start at a lower dose and try to kind of work with that dose to where the bird isn't, and talk with the owner this week, and the bird is doing better. And but we still don't know exactly why he has seizures, and we can't run an MRI, we can't do a CT on it, and the blood, you know, we have to be very specific with how much blood we take and what we can do with that blood on a 28-gram bird. So we're not talking about a 450-gram African gray, but those are some things that you can do. And like you said, you've seen where people have done that, but that's what they're looking for, over and above saying, well, we're just going to treat so he doesn't get seizures. Then if it's a stroke, that's all you can do. If it's a brain injury that has developed into this, that's about all you can do. But as far as the and then if it's a tumor, that's a whole different story.
Wow. Okay, so that looks like we have time for today with the questions. If we didn't get to your question today, we will email you a reply with the answer. So I want to thank you, Dr. Tully, for coming on with us again for Ask the Vet, and we hope to see you back in July for some more Q&As with questions from our audience.
Fantastic questions, Laura. Fantastic questions. Thank you, and I want to thank all of the participants for you know, the questions and all they do for their birds. And we try to keep going and to provide the best that we can for our feathered friends. I'm telling you. So thank you.
No, I know, even if, I mean, not even having a question, I learned so much just from other people's questions and just in general. So I really, really appreciate it. And for our viewers, we are working on our next great webinar. If you keep a lookout for our newsletter and on lafeber.com/petbirds, and we will have an event on that topic hopefully soon, working behind the scenes here to bring you another great webinar. So check out lafeber.com and keep an eye out for our next newsletter. So Dr. Tully, thank you very much. Everyone, have a great weekend. Stay safe and stay healthy, and all the best to you and your flock.
Yes, thank you. Thank you, Brenda, Lafeber, everybody. Thank you. Thank you.
Thank you, Dr. Tully.
Bye-bye.